Dr. Ken Landau. Thanks for watching. Let's talk about Lasix, also known as Furosemide. This is a medicine that was discovered in 1962 and has been on the market since 1966 here in the United States. It's a loop diuretic. It's a water pill. Now, most people think of diuretics as hydrochlorothiazide. That's one of the thiazide diuretics. Well, those drugs, also simply referred to as HCT or HCTZ, are used more for blood pressure control. They're not really good for getting rid of excessive fluid. On the other hand, furosemide or Lasix, that's really a water pill or a diuretic, and it helps to get rid of excessive fluid that the body retains. It's on the World Health Organization list of essential medicines, and it's available in multiple different strengths to be taken by mouth. It even comes as a solution to be taken by mouth, or may be injected. The main uses are to get rid of edema or swelling or fluid retention that comes along typically in the aftermath of congestive heart failure or liver disease, maybe cirrhosis or kidney impairment, maybe nephrotic syndrome. It's used when diuresis is necessary and occasionally could be used for control of high blood pressure if the kidneys don't work well. Can also be used as an adjunct if a person develops swelling of the brain, maybe from trauma, maybe from a tumor, maybe from surgery. Maybe a person develops fluid in the lungs, typically from heart disease, congestive heart failure. And also can be used if the calcium level in the bloodstream increases. The calcium increases because of a tumor in the parathyroid gland, or maybe because of malignancy that's metastatic to the bone. Now, under normal circumstances, the blood circulates through the kidney. It gets to the area of the kidney known as the glomerulus. These are little teeny-weeny areas where the filtration occurs. Then the blood goes back to the bloodstream, and the fluid, now that's been filtered by the glomerulus, gets into a variety of different tubules. First into what we call the proximal convoluted tubule, then into a loop that we call the loop of Henle, and then into the distal tubule, and then finally into the collecting ducts. And it's important to realize that all these different areas of the ducts inside the kidney have different kind of function. Normally, those ducts are going to reabsorb over 99.5% of all of the sodium that is filtered out. So the glomerulus filters the sodium, and the sodium goes right back into the bloodstream in those ductules. Well, the way that Lasix or furosemide works is it works on that loop of Henle, especially the ascending loop of Henle. And Lasix inhibits one of the chemicals that's necessary to help bring the sodium back into the bloodstream. Well, unfortunately, it works on a little more than just preventing the sodium from getting into the bloodstream. So not only does sodium get excreted, because it can't get back into the bloodstream, but so too you're going to lose potassium and magnesium and chloride and calcium. Now, additionally, the furosemide might work on some other areas of the kidney as well, as opposed to, let's say, the hydrochlorothiazide, the standard thiazide diuretic. That's only going to work on the distal tubule. That's where about 5% of the sodium is reabsorbed. So you can see there's a big difference between the two. And certainly in people who have advanced kidney disease, they can get significant increase in fluid. We call it the extracellular fluid volume, going to get up to 30% increase in the fluid inside the system. But as the kidneys become less effective, then the thiazide diuretics don't seem to be very effective at all. And even with kidney disease, furosemide isn't going to be as effective, because with kidney disease, they're not getting as much blood going to the kidney. And not only that, we're going to find that there's not as much albumin or protein floating around that holds the sodium, that holds the furosemide and takes it to the kidney. Well, a good idea is to take furosemide if you happen to have bad kidneys, because it seems to retain some residual kidney function. As far as high blood pressure is concerned, this is not really a first-line drug. Might be a second-line drug when you have that kidney problem that we talked about, when the antihypertensive effect of the thiazide diuretics isn't working so well. Now, some people take it for weight loss, for if they have temporary fluid that they want to get rid of, or they have to go and pass a special kind of a weight test, or they're in a competition for weight loss. Some people will take this, or women around the time of the menses, when they tend to retain a little bit of fluid, may take this, but it could have sort of an adverse effect too, because what happens is that, yes, indeed, it gets rid of the fluid, but when it gets rid of the fluid, the body tends to want to increase the amount of fluid that you take in by mouth. You get thirsty. And the body typically can't differentiate very well between thirst and hunger, so you might start eating and drinking more, and as a result you might weigh more simply because you started off on the idea that you were going to lose weight. Well, when you take the pill, it's going to work within an hour if you take it by mouth. It peaks between an hour and 2 hours and continues working for somewhere between maybe 6 and 8 hours, as opposed to if you get it intravenously, an injection of the medicine, well, it's going to work within 5 minutes, it's going to peak at about 30 minutes, and it's going to last up to about 2 hours. When it's given intravenously, it's given at a half of the oral dose. Sometimes a person can get some side effects. Side effects can be significant depending on the person's underlying condition. So the side effects might be a little nausea, vomiting, diarrhea, constipation that you can get with any kind of a medicine, but it also can irritate the stomach, or sometimes because of a change in the electrolytes in the body can cause some cramping or loss of appetite. Rarely will a person get pancreatitis, but sometimes muscle spasms or weakness or restlessness or spasms of the bladder because of all the excess fluid going there. And if you lose too much fluid, you could develop what we call orthostatic hypotension, where you stand up and you don't really have enough blood circulating, so you get a little dizzy or lightheaded. In some people, it's associated with vertigo or headache or blurred vision, and might increase the cholesterol a tad. But we can divide the major side effects associated with Lasix or furosemide into 3 different areas. There's a low volume, an electrolyte imbalance, that's one. People can get hypersensitivity reaction, or they can develop hearing or ear problems. Well, one of the major problems with Lasix or furosemide is a decrease in the potassium. That's why you have to take some potassium supplement, especially if you're going to be on the medicine for a long period of time, especially if you don't have adequate electrolytes to begin with. And as a matter of fact, you can now buy Lasix or furosemide already combined with a medicine that helps retain the potassium, or with potassium itself. And remember, you have to be a little bit careful because the calcium level can get to be low, magnesium level can get to be low, chloride can get to be low. And interestingly, the uric acid can increase, and sometimes that may be associated with gout, and the blood sugar can increase, and that may be associated with diabetes. And your blood pressure can become too low if you're dehydrated, and certainly it becomes worse if you drink alcohol, or you take opioids, or you take one of the barbiturates. Sometimes people develop hypersensitivity reactions. Hypersensitivity reactions are typically mild, but they can be an increase in your sensitivity to the sun, or sometimes people develop itching or hives or a rash. And sometimes the rashes can be quite severe, especially if you happen to have a sulfa allergy. So if you have a sulfa allergy, probably a better idea to take a different kind of diuretic. And if you have lupus, well, it might seem to worsen it. The hypersensitivity reactions may actually involve the blood vessels themselves, and you could get what's known as a vasculitis. That's relatively uncommon. And even more uncommon, people can develop a problem with the bone marrow where you can't manufacture the blood cells. Well, additionally, furosemide or Lasix might cause either temporary or permanent hearing loss, or deafness, especially when it's taken intravenously at high doses, or people have other ailments, or people are taking certain other kind of medicines. Maybe if you have cancer like cisplatin, or maybe you're taking an injectable form of an antibiotic. Well, if you take it for a long period of time, if you take this Lasix or furosemide for a long period of time, it might be a good idea to take some thiamine. And certainly if you're getting a radiocontrast study where they inject some material, some iodinated material into your veins, it probably is not a good idea to be taking Lasix. You really want to be pretty well hydrated when they inject the iodine, because otherwise the iodine might interfere with the kidney function. And if you happen to take a high dose of Lasix or furosemide, it might alter the way the thyroid hormone binds to its binder in the body. So temporarily you might develop a little elevation of your thyroid hormone, and then it might fall to relatively low levels. Well, if you have a tendency to urinary retention, maybe you have benign enlargement of the prostate or difficulty emptying your bladder, has to be taken with caution because it might cause acute urinary retention. And furosemide or Lasix doesn't seem to mix very well with aspirin or the nonsteroidal anti-inflammatory agents. They can lead to increased toxicity since both of them are excreted by the body pretty much the same way. And if a person has a condition, for instance, like hepatic cirrhosis and ascites, extra fluid, especially around the belly, well, a brisk diuresis associated with the thiazide might lead to hepatic coma and to electrolyte abnormalities. So what we try to do is we try to improve the underlying condition first and then start the Lasix. Well, Lasix should be taken on an empty stomach either an hour before you eat or 2 hours after you eat. And most of the time it can be taken just once a day. Sometimes it has to be taken twice a day. And if you're going to take it twice a day, well, maybe early afternoon or an hour before dinner. But certainly don't take it at bedtime. If you take it at bedtime, you're not going to sleep. You're going to be awakening all of the time because you're going to have to go and urinate. Well, as I mentioned, you have to be especially careful as far as kidney damage is concerned if you combine it with the nonsteroidal anti-inflammatory drugs like ibuprofen or Aleve or naproxen. You have to be a little careful as far as the potassium is concerned. The potassium will go down, and if you're taking certain kind of medicines, that can lead to an arrhythmia, certainly potentially a life-threatening arrhythmia. And if you take an antidepressant, it might lead to hypotension. So if you're taking an MAO inhibitor or a tricyclic antidepressant, that may cause problems. Additionally, if you're taking Tegretol, also known as carbamazepine, that drug is going to lower the sodium, so you got to be a little careful taking Lasix on top of it, and it certainly may exaggerate the antihypertensive effect if you're taking antihypertensive medicine, especially if you happen to be taking an angiotensin receptor blocker, maybe valsartan, or maybe you're taking an ACE inhibitor. And you've got to be careful if you're taking an antipsychotic drug, one of those phenothiazine type drugs like Abilify. It might lead to some problems. And if you're taking digitalis type preparations, digoxin, that low potassium might cause problems. Also might cause problems if you're taking lithium or if you're taking cyclosporin, if you've had a kidney transplant or something of that order. If you're taking Dilantin or methotrexate or a cephalosporin antibiotic, have to be a little bit careful. Even have to be careful if you're taking a drug for gastroesophageal reflux disease, heartburn, sucralfate. And if you happen to be taking warfarin, you got to be a little bit careful. Can it be taken during pregnancy? Well, we just don't know. Yes, if really necessary, but certainly there are some risks associated, and if you're breastfeeding, it can inhibit the lactation because it's going to cause dehydration. Now, there's a small incidence in mice, in female mice, at high doses of mammary gland carcinoma, but doesn't seem to happen in humans. It has erratic absorption, so only 50–60% at best is going to be absorbed. It's going to be bound to the protein, and it's going to be excreted pretty much unchanged in the urine. with severe edema, there might be a problem, because if there is all this edema, well, it might not get absorbed, might not get normally absorbed, because there isn't a lot of circulation from the gut to the bloodstream, and that can be a problem. Well, before you start a drug like Lasix, you need a bunch of blood tests. You need the sodium and potassium and chloride and magnesium and calcium, and then you need the kidney function test and the liver function test, and you need your blood sugar check and the uric acid, make sure you don't have the gout. And then, on a relatively regular basis, you need your blood pressure evaluated and check to see if you're really thirsty, or if you're weak, or if you're lethargic, or if you're restless, or if you have muscle aches or pains, because Lasix can interfere with all of those areas. If you overdose on Lasix, you'll be dehydrated and your blood pressure will go down, and you'll lose potassium and you lose chloride, so you take some extra fluid. Now, if you're taking a diuretic like Lasix or furosemide, you should be careful about taking too much in the way of salty foods. So you should cut down the amount of salt that you consume. So that means the canned ravioli, or the chili, or the salted nuts, or the pizza, or the burritos, or the breaded or salted or canned meat or fish or poultry. You should stay away from cold cuts and bacon and ham and hot dogs and sausage, and most soups that you get commercially, salad dressings, tomato-based condiments and pretzels and gravy, all relatively dangerous because they contain so much sodium. And that's what Lasix is trying to get rid of. On the other hand, you should consider consuming foods that have high potassium levels, maybe bananas or prunes or raisins or oranges or orange juice. Typical dose for Lasix is somewhere between 20 and 80 milligrams, taken once a day, and you could repeat it in 6 to 8 hours, maybe 8 o'clock in the morning, an hour before breakfast, maybe 2 o'clock in the afternoon. Some people can get by with taking the medicine for 2, 3, or 4 days a week, and then you can have several days off. If you're taking the drug for a long time or at a higher dose, chances are you need to have a blood test. Make sure the potassium, make sure all those other substances are okay. Now, as an antihypertensive, it could be taken at a dose maybe of 40 milligrams a couple times a day, but that's not a first choice. In older people, well, they're not going to be able to get rid of it as fast, and the initial effects as a diuretic are going to be delayed. Seems to be a drug threshold, a dose threshold. You have to have enough for it to become effective, but you can't have too much. So there's a window there where it can be given. And the maximum effect, remember, is going to occur within 1 to 2 hours. A second dose is not going to be as effective as the first dose. Now, the cost, it's very cheap. It's very inexpensive. Whether it's cash or whether it's coupon, a dose is going to cost you less than $10 to $15 for a whole month. Now, an interesting sidelight on Lasix or furosemide, it's widely used in American thoroughbred racing, and it's been used since the 1970s, typically intravenously. It's given hours before the race, and that includes Justify, who won the Triple Crown in 2018. Well, racehorses seem to develop a condition that's known as exercise-induced pulmonary hemorrhage. This occurs with about 90% of racehorses, especially in the United States, due to inbreeding. What happens is the heart and the spleen pump such vast amounts of blood that the volume going through the lungs tears some of the small blood vessels, and the horses actually bleed into the lungs. And in 3 to 5% of the horses, these thoroughbred horses, they're going to bleed through the nose, and ultimately that can lead to lung damage. So horses that bleed from the nose at least 3 times, well, those horses are going to be banned from racing in most states. So it was just found that Lasix or furosemide intravenously could remedy the situation, and it's been legal here in the United States, beginning in New York, in 1995. And some states allow it for all racehorses Other states just for confirmed bleeders. Now, there are alternatives, nasal strips, that are around since about the 1990s. What happens is that about 4 hours before the race, the horse is given an intravenous injection, sometimes intramuscular injection, and that causes the horse to begin urinating phenomenal quantities of fluid 20 to 30 minutes later. That's going to cause a decrease in the volume of the blood, which means that there's going to be a decrease in the lung. And we can decrease the severity of the bleeding by 50 to 70%, not 100%, but 50 to 70%. It's only allowed, by the way, in the United States, not in other countries. Now, unfortunately, this medicine, just like with humans, it can lead to dehydration or decrease in potassium or sodium or magnesium or chloride. And especially if you're talking about a racehorse, this can lead to muscle cramps or fatigue or gastrointestinal problems or even collapse and coma. And there's some abuse going on of medicines like furosemide, for instance. The Seattle Mariner, Robinson Cano, well, he was banned from baseball for 80 games beginning in May of 2018 because he tested positive for Lasix. And he's accepted a penalty that's going to cost him somewhere around $12 million just in salary. So Lasix, the brand name, furosemide, the generic name, it's a standard diuretic. It's used to remove excessive fluids, especially if there happens to be disease of the heart or the kidney or the liver. It's commonly used, and for the most part, it's properly used. But remember, it's not necessarily a good idea if you happen to have a little extra weight and you want to get rid of it for some reason. It's not a good idea to take it necessarily around the time of the menses or in women who seem to retain fluid. The problem is that the drug, if used improperly, leads to a heck of a lot of potential problems. So let's keep this one for people who actually have disease. Thanks for watching. I'm Dr. Ken Landau.